All right, we've got some other people joining on, but we'll go ahead and get started. Good morning, everybody. Welcome to First Cup. I'm Katie Harwood. I am the manager of events and Access Tallahassee at the Chamber of Commerce. So welcome for those of you that I don't know. We have started this event just as a way to stay connected, to keep in touch with what's going on in our community. And I personally think that they've been pretty fun so far. So we do have a few housekeeping things before we get started. Please go ahead and mute yourself for now. You don't have to have your video on. Feel free to keep laying in bed in your PJs, but definitely mute yourself. And then towards the end, I'll open it up for Q&A, and you can either put your questions in the chat box as we go, and I can read them out. You can raise your hand by clicking the More button at the bottom of your screen and raise your hand within Zoom, or if you were on last week, just physically raise your hand and someone will see it and call it out to me. Otherwise, I have a few questions, and then we really want to hear from you guys. We do have a sponsor this morning. Skylar from TrueLeave is here. Good morning, Skylar.
Good morning. Sorry, I was muted.
No, that's good. That means you're listening. You want to tell us a little about what's going on at TrueLeave this week? Y'all had a talk last week.
Yeah. So if you're not familiar with TrueLeave, we are the largest medical cannabis dispensary in the state of Florida. So we have 45, almost 46 dispensaries around Florida, from Pensacola all the way down to Key West. Our other store should be opening here in the next 2 weeks, but that's going to be in Titusville, so it's a little bit further away from Tallahassee. But we have launched some True Talk series that I host twice a week. And the one today is going to be with our medical director. So I would strongly suggest signing in if you can, because he's going to be talking about the power of the plant. So all things cannabis. He's going to also be talking about ways to utilize cannabis when you're on different medications. So it's going to be really interesting. And then we have another one next week on the 21st. That is mindful meditation. So we will have somebody coming in to do breathing work and meditation techniques and stuff like that. So we figure that that's going to be strongly needed, because that is the day after 420. And for those of you who don't know, that's like a national holiday in the cannabis world. So it's a bit crazy. So we have a ton of sales going on and stuff too. But I'm so glad we were able to sponsor this, since this is in our city where we have our grow and we have our manufacturing plant, and we actually started. So Tallahassee is kind of near and dear to us. And the last thing I want to leave you with is we are hiring. Shameless plug here. If you know anyone that is in need of a job due to COVID-19, if they go to our website at www.trueleave.com/careers, they can find all of our open positions, and we have hundreds in the Tallahassee, Midway, Quincy area. And they're going to range from a marketing coordinator all the way to a processing person, so someone that works in our processing plant or our grow. I may have to hop off a few minutes early at 9:30, but I'll put my email in here. And so if anyone knows anyone that's applied, let me know, and I can help push their name through.
Awesome. Thanks so much, Skylar. You guys have a lot going on.
We do. We're super busy, but it's good.
That is good. It's really good news to hear. Awesome. Without further ado, I'll welcome our guests. We have Ryan this morning and Kyrie. I just said that wrong, didn't I? Kyrie. Ryan and Kyrie, why don't you introduce yourselves? Thank you so much for being here, by the way. I have no doubt your world is crazy, and so thanks for taking 30 minutes out of your Friday morning to chat with us today.
For sure. I'm Ryan Smith. I've been at Tallahassee Memorial for 10 years now. So I started in the ER, actually started about the same time Kyrie did in the ED, and then decided to go the administration route. So been here for 10 years, worked in the clinical operations world, and currently the Chief Clinical Officer at Tallahassee Memorial now. So excited to be here this morning and share our knowledge of what we've learned so far in COVID-19. So we're not experts by any means, but we have a lot of exposure. So.
And I'm Kyrie. I also started in the ER about 10 years ago, and I've kind of worked my way up there. ER is my passion, so I've stayed there. But yeah, we've done a lot this past month trying to get ready for this stuff. So we're happy to share what we know and what we've experienced.
Awesome. Thank you so much. So I'll just start with what I would imagine is the question on everybody's mind. What does it look like? How much longer are we going to be doing this? What kind of data are you seeing? Any new projections out that you can share with us?
Let me tackle that one. There's many of you are aware that TMH published the CHIME report, which was looking at the projections and looking what the impact to Tallahassee is. I think a couple of things have changed since then. There's a lot of models out there. Myself, I think the models are models, but what we see in the real world is kind of what we base it off of. It's still a lot of unknown. I think there's things that have changed since we published that model. Some of the models do not factor the heat, and that's the unknown part there. When you look at the epicenters of the United States, I think there's known reason for the epicenter. You look at New York City and you look at just the population in New York and the density. It was in New York prior to anybody knowing it was in New York. It was in Washington prior to anybody knowing that it was in Washington. You look at New Orleans and you look at, Mardi Gras was there, and Mardi Gras conducted and it was, there and it spread like wildfire. You look at Miami and South Beach. I think we will see an impact. I think we're starting to see an uptick now. I think there's things that have changed in our environment that, we didn't anticipate. I think one of the lessons learned for us is it really takes one individual only to have a massive outbreak. And you look at Albany, Georgia, and you look at, there's 2 funerals that were held in Albany, Georgia, and you see the impact that the COVID-19 has had in Albany, Georgia. I think, we were hoping that we can maintain and protect our bubble. I think our bubble has been compromised here in Tallahassee. Many of you are aware of the Tallahassee Developmental Center, and that's on the news. But I think it's a similar situation where you had one or a handful of individuals that had COVID-19 symptoms, and how contagious this is, whether you're asymptomatic, how quickly this spreads. I think the city of Tallahassee has done an incredible job with locking down the city. They were very proactive. That's what gives us hope here. I think this was a good situation for us where, everything was locked down prior to spring break. So you had the kids that left and they went down to, to spring break, but they didn't return here to Tallahassee from all parts of the world. We're not an international hub for an airport. We don't have a lot of air traffic, which is a benefit to us. And then we have rural counties that surround us. And I think everybody from what we have seen are, doing the self-distancing and quarantining, self-isolating fairly well. We have seen an impact. This week we have seen, more presentation of COVID-19 symptoms. But I still am more optimistic, as long as everybody continues to follow the guidelines from, the state and the federal that, self-isolation, quarantining, that hopefully will not become an epicenter. But I think there still is a risk. And I think, that is all upon us to make sure that we fulfill our obligation to make sure that we remain safe.
It does seem like we've kind of been in a bubble, and I know personally part of me is either like waiting for the other shoe to drop, or maybe we will get out of this unscathed more than other communities. So which way does it look like it's leaning right now? Knock on wood, of course.
I will say, and this is my prediction, and Kyrie, you can please chime in. I think the next 2 weeks for us will be the eye-opening moment. I think that we now know that we've had community spread. We now know that our cases have increased. We now know that we have, group home settings and long-term cares that have been impacted or compromised. You see what's happening in Jefferson County, and that's public. You see what's happening in Suwannee. Then you see what's happening at Tallahassee Developmental Center. The next 2 weeks is going to be crucial, and it's going to really let us know, are we going to be able to stay isolated or protect our bubble, or are we really going to get hit and impacted, severely? I still remain more optimistic than some. I think there's a big debate amongst our healthcare community of, which way we're going to fall. We are preparing on our side that, we're going to get the crisis that big cities are facing, and we should prepare. I think it's hard to say, and I think the next 2 weeks is going to be the real telling factor in how how Tallahassee is impacted by this.
And I would say from an ER standpoint, we have a lot of the same feelings, especially when you're dealing with a lot of type A personalities that want to kind of get in there and do stuff. It's kind of like sit back and wait. And so I'm dealing with a lot of that on the ER side of things, but trying to remind people that the longer we push this out, the better. If it keeps getting pushed back and keeps getting pushed back, then that's a positive thing. That means we're not having this huge spike and surge. We want it to get pushed out. We want it to see a slow incline and not a huge, drastic change all of a sudden. So even though it's tedious and kind of like pulling a Band-Aid off slowly, we want it to be that way.
So more and more people are being compromised. Our community is seeing that more often. We have the testing site at Northwood. I actually just drove by it the other day for the first time, and it's a mix between like a high school driver's ed course and like the apocalypse. So it's kind of a weird feeling as you drove by. Obviously you can't go without a doctor's note, correct? They won't.
Correct. We have, if you do not have a primary care physician, we have a model set up to take care of that. But the goal is to have a physician order prior to coming.
Okay, and so what is that process like? You'll get your recommendation from your doctor should you think you have symptoms, correct?
Right.
And pull through.
A lot of, in terms of if you have a primary care physician and calling them on the phone, kind of giving them a rundown of symptoms. Some of them will do it over the phone. Some of them want to see and assess you. So that's an individual physician practice. But ultimately what they're doing is, triaging their patients, ordering that swab through LabCorp request, and then sending the patients out to Northwood for the actual collection piece of it. Obviously, we're having a lot of patients that come into the emergency side of things, so we've got a different type of model set up at both of the emergency departments. So there's kind of the community one at Northwood that's more based on primary care setting, and then your emergency model that's based on drive up for patients that are having symptoms or concerns, then we can kind of triage that. And our ultimate goal is to try to keep these patients out of the ER as much as possible. I know we all know the statistics, but 85% of these people are going to be fine, and it's like flu symptoms. So our goal is to try to keep those patients out of the hospital, one, so we're kind of protecting our internal bubble, but so that we're getting the right resources to the right people. We don't want to have an influx of patients that could care for themselves at home safely and utilize those resources on them versus somebody that actually is sicker and needs hospitalization. It protects internally us from spreading it inside the hospital and helps us keep the practice, at their house instead of in the hospital, if that makes sense. So community drive-through and then ER drive-through, they're slightly different, but same goal.
How many have you tested?
Through ER, we're at about 350 swabs. We've had more people actually come through the drive-through, but we've tested about 350.
Then at Northwood Center, there are about 1,300 tested through the Northwood Center.
And what's the turnaround time on that? Have the tests, they've been changing a little bit since this all started?
Yeah, so when we initially did it, it was like a 5 to 6 day turnaround. We are sending these labs out. So we're sending them to LabCorp, we're sending them to Quest, and so we're kind of at their mercy to some extent. A couple weeks in, we were seeing really long times, up to 2 weeks to get results back. But in the past week, it's gotten a lot better. I'd say we're getting most of our results back in about 4 to 5 days now, which has been very helpful in being able to treat patients and making sure that they're getting the right care into the right areas more quickly.
And I could touch on that a little bit. I think that has been our biggest challenge. And as we push this curve out, things are responding in the market in healthcare. So your PPE, which is our personal protective equipment, we're starting now to see suppliers and vendors meet our demands on our side. So, we're benefiting for this curve being pushed out because our healthcare workers are protected now. Lab, this is a new test for all. And you have the FDA approval that came down and said, okay, we certify this test that is a valid test for COVID-19. The problem is they did that all in a lab, and then you had to have all the reagents follow that. So, you had these vendors trying to produce these mass quantities of reagents, and then they sent reagents to New York City, to Italy, to other places. So now we're just starting to see, the vendors from a PPE standpoint and a lab standpoint catch up to the demand that's in the market.
And so with the PPEs, there was talk that you guys are prepared for worst case scenario, and there was a need for masks in the hospital. Where are y'all with that? Are all of your workers covered, or are you still needing that? What do the shortages look like?
The community has been outstanding, so they have helped us significantly. There's been a couple of things that we have changed here. You know, we are starting to get quantities of good PPE. What we have decided here is if you're a direct care clinician, if you're having direct exposure, not even a clinician, if you have a colleague that has direct exposure to patient care, registration, nurses, respiratory therapists, et cetera, then you'll have a hospital grade mask, whether that is a surgical mask. If you're caring for patients that are COVID-19, of course, you're going to have an N95 mask where they're higher grades. But we want to make sure that we protect each other as well. Most of us have these masks that we have on here. This is actually a model that was based out of Shands, and it's actually using the surgical wrap. And the community has been great in helping us sew these wraps here. And these are actually an N99. And that's the percentage of air that's filtrated to the mask. So an N95 is 95% of the air. And then the N99 is actually 99. This is actually a higher grade than the N95 that we're using. It just is not as fitted as the N95. And then individuals that are indirect, meaning they don't have the direct contact with patients, we have a hospital-approved mask, which is the cloth mask that we're allowing them to wear, just to make sure that we protect each other. They still meet our hospital grade, but we don't want those in the patient care because they're cloth, and of course, you know, they have the potential to be compromised with, you know, becoming dirty or whatever it may be because they're cloth. But we have seen a huge response from the community in helping us, you know, make sure that all our colleagues are protected with a mask.
That's fantastic. That's Tallahassee for you, though. I mean, we take care of each other.
That's awesome.
Yeah. There's a question in the chat box from Stephanie. How is TMH staff doing other than staying at home and having to go to work? Is there anything that we can do for our healthcare heroes aside from masks? How's everybody's mental health? What do y'all need? A vacation?
I think that it's been, like he was saying, that the masks have been a huge help. I think everybody kind of sees that and feels it. We've gotten a lot of people that have sent in cards, which we kind of read at our daily huddles and kind of stick around the unit to kind of inspire people or, you know, remind them that the community thanks them for their work. We've had people drive up to the ER to drop things off to try to help out, which it's great when it's, you know, more masks and things like that. Sometimes we get drop-offs that aren't completely appropriate, but we try to sort through those. And I think just the staff being able to see that and seeing that people are trying to help them and trying to give them the things that they need, that's honestly what they want. Like, just knowing that the community is appreciative of their work is the main goal.
I tell you, one of the big and most impactful one is simple. You know, somebody took chalk and they drew the chalk, and you see it through social media, you know, the healthcare heroes here, and, you know, healthcare heroes worked here, and just how far that went through our staff is just amazing. I will tell you, from a leadership standpoint, our staff is just as scared as everybody else. This is new. You know, nobody knows, you know, the long-term impact of this. You know, everybody sees what's going on in the media, you know, and these individuals are coming to work and making sure that, you know, our patients are cared for each and every day. You know, we're learning like everybody else is. You know, I think just knowing that people appreciate them, knowing that they're sacrificing, you know, their families, and, you know, they're coming to work willingly, just to have that social support is big.
Yolanda Hugh put a question in the chat box. Is there a way for assisted living communities to connect with the hospital leadership to better plan for ER transfers and returns?
Absolutely. So I'll talk about that a little bit. A couple of things that we have done, and we've done it proactively. You know, right now, you look at the FDA, there's really nothing that we're doing any different than any other hospital. You know, this is really supportive care with oxygen and making sure, you know, we keeping a close eye on them. So there's really not a silver bullet out there to care and cure these patients at this time. You know, we're waiting for vaccine, we're waiting for other medicines to come out. But early on in this journey, we went out to our local critical access hospitals. So we went to County Liberty, we went to Madison, to Weems, to Doctors Memorial, to Jackson, and shared the same knowledge and information that we have learned here with them. And we wanted to, our purpose of that was to teach them and share our knowledge so they could care for patients and make sure that they mitigate any exposure risk there, as well as care for medical surgical patients there. And then if they need a higher level of care, of course, we're here and we're happy to take those patients here. Long-term care, we've done the same thing. You know, we have done a lot of work with the Tallahassee Developmental Center. You know, we shared our knowledge that we've had. We've actually sent our staff out there to say, you know, here's how we do proper donning and doffing. Here's how we do PPE. Here's the infection prevention practices. You know, we've actually lent supplies to them from, you know, vital sign machines and other things so they can make sure they can care for. You know, the transfer back in once they're discharged is hard because you have a very fragile population that, you know, they congregate together. And you, from their side and the Agency of Healthcare, you know, we don't want to send a high-risk patient back to a long-term care that could potentially be positive and then, you know, infect that whole population because they are fragile. So right now we're doing 2 tests, you know, and the tests have to be negative, and they have to be 24 hours apart. And once you have 2 consecutive negative tests for COVID-19, then the individuals are going back into the long-term care setting, which is working, but it's extending our length of stay here, but it's the right thing to do. We don't want to send them back to the long-term care and then have a bigger outbreak than what's needed.
And what about non-COVID transfers from nursing homes?
We're screening those as they come in. So in terms of if they're coming into the ER, we are getting a report on those patients ahead of time. We're screening every patient that comes in, whether they walk in or whether we're getting a call from an ambulance company or an outside facility to make sure they don't have cough, fever, those types of things, because we are trying to immediately isolate those types of patients away from our regular patient population. And so whether it's a COVID patient or not, we need to know that information so that we can put them in the right place. And so if it's a non-COVID related nursing home patient or any patient, we're still going to screen them, and then we're going to move them to the appropriate, you know, room when they get to our facility so that we can care for them. And then getting them back is kind of the same thing.
Yeah, and I'll tell you one thing that we've been adamant here, and I think this is a difference that what we have done in Tallahassee compared to other places is we use negative airflow room for all of our COVID patients. So that's the airflow is negatively pulled out of the room, and it goes through a HEPA filter and UV lights. And we are adamant that that's the standard of care for us here. And it protects our colleagues as well as protect other patients. So anybody that has COVID-like symptoms are placed in a negative airflow environment. And we're not just placing them in a standard room to make sure that we don't have the cross-contamination.
That's fantastic. Amanda Wiggins put in our question box, are you seeing any of your colleagues or friends that aren't immediately needed in Tallahassee going to places like New York City to help? If so, what's that look like for them?
So I haven't had anybody from the ER actually go yet. We've had a few people that have talked about it. In terms of ability to work, we are making anybody that goes up their quarantine for 14 days when they get back before they can come back to work, just because it is a high-risk area. But we're not, you know, people are allowed to do what they want to do and make their own choices.
Yeah, I think we're on the beginning of that thing. And, you know, I think it's a delicate balance here because we know the next 2 weeks are going to be, you know, our decision point, you know, and it's kind of, it's a challenge here. We want to lend out help and, you know, we want to assist others. But then again, if Tallahassee is impacted, we want to make sure that we have adequate labor and clinicians and skill here in Tallahassee to care for our patients. So we're taking it on a one-by-one basis. And I think we've had one, that has gone to New York thus far. But most people know that they're starting to see the uptick here and making the decision to stay.
Have there been any changes to incoming patients that you may not think about? So like my sister works at Winnie Palmer in Orlando, and within Arnold in the children's wing. And she has had a new patient every single day for like hot beverage spills because they're all at home and everyone's getting into trouble. But like women's stress heart attacks from being at work aren't happening as often. So like those departments are kind of slow right now because no one's at work getting worked up. So has there been any shift up here in anything you've seen?
So in terms of ER stuff, our non-acute stuff has definitely fallen off. So the basic, I have a sore throat, or I stubbed my toe, or I think I sprained my ankle, that kind of stuff has fallen off drastically for us. Our trauma alerts have stayed the same, which has been interesting to see. So a lot of people trying to do home improvement projects while they're at home or getting in fights with their significant others in the house, those types of things from from being on lockdown and not being able to leave, taking on little projects and stuff like that. So traumas are definitely still high.
It's very interesting. I tell you, it's, we had this discussion the other day, and it's, your STEMIs, your heart attacks, your strokes, those numbers have gone down. And, we don't know if that's stress related, or it's going to be interesting. I think that when this is all over, they're going to be a big look at things and say, what caused heart attacks, what caused the strokes, because from that perspective, those numbers have gone down. Yes, traumas have gone up because people, I think, are just frankly bored and they're trying to find things to do. But from your other acute, they have gone down. I will tell you the volumes in the ED they're down about 40%, which is significant. And we never anticipated that going into this. And you ask, if you don't have access or as easily access to primary care, most people are doing telemedicine. It begs the question of, emergency departments, how do the emergency departments, do they return to normal after this? Does the volume come back when all this is returns to whatever a normal state is? It's going to be interesting to watch and see how things play out.
Yeah, what are the conversations about what the future looks like? And a lot of us have already turned to telemedicine. A few in our office have even had doctor's appointments via telemedicine. Do we think we'll see more of that going forward?
I think so, for sure. It's definitely something that's been around for a few years now, and we've seen it kind of in little pockets around Tallahassee, and even in the hospital, certain groups have been using it. But it's been amazing to see how much that has just blown up over the last month. So I think now that it's one of those things, previously it was like a new thing, people were hesitant to do it. Now that people are kind of, I don't want to say forced into doing it, but it's a good alternative for them to use right now. I think as they are more comfortable with it, they'll start using it more frequently.
And the change in this is, prior to this event, you could not bill over telemedicine. So a primary care physician could not see you and bill for you, in a primary care environment or any environment. CMS, Medicaid, Medicare came through and they said that during this event that will allow billing through telemedicine, and that really has changed the paradigm. The question is, does that waiver still stay in place post this event? What we're hearing now, it looks like it will, because it's really changing the landscape of healthcare. I think there's a lot of benefits. And when we look at, our rural community and critical access hospitals, if our physician here that's an expert could put eyes on a patient over in County Liberty and determine what level of care they need and start that care prior to their arrival here, that's big, and that's crucial. So I think I'm a big fan of telemedicine. I think it has had a lot of positive benefit, and I think a lot of what we're doing now will carry into the future when we return to a normal state.
It's yeah, like you said, we've all been kind of forced to dive in. So maybe people who hesitated before are learning on the go.
We all learn.
Yeah, exactly. So you're saying the next 2 weeks is kind of our telling point, correct?
Correct. That's my prediction. I think when you see the uptick and you see how Tallahassee has been compromised, I think that the next 2 weeks will be very, very telling.
What are y'all doing to prepare for another surge that could happen after the peak? Like, do we think of relapse could happen? Does that happen in the summertime? Do germs not care?
Well, we don't really know with this virus yet. So this is a new virus, so we haven't seen an annual or seasonal pattern with it yet. So we don't know, and that's kind of one of the things that we're trying to prepare for, but it's difficult because we don't know how it's going to react. So we are definitely know and prepared for the fact that, especially if we start lifting some of the social distancing things, that we could see a resurgence of this. And I think other areas have seen that. So we know that it's a possibility. I don't think that we will, take down, we'll kind of, if we get past our peak and kind of start to go back to normal, we'll kind of have everything set up in the background so that we can pull it back out again really quickly if we need to.
We've done a lot of work here on the facility side to prepare for a large number of patients, and we continue to do that work, and we're not going to take that away. I think the unknown is if the peak drops off, why? Was it heat related? I think if you look in the lab, there's data right now that it's not in mass quantity to say that this virus spreads less in the heat. And you think about it is it's a lipid. So if you have heat and you have high humidity, it doesn't carry as much. So I think that the virus will still be here. It's like the flu. The flu never goes away, but in the summers it drops off. But I think this virus is, I think I heard the statistic 1,000 times more contagious than the flu. The interesting part is I think your flu numbers over the next couple of years will drop down significantly, because I think people will take social distancing seriously. And I think you'll see a drastic drop in flu. We're still in our peak flu season now. And what we saw at the end of this, when the social distancing started occurring, our flu numbers just went to zero. And it was crazy. Overnight, they went from, we were seeing 20% of the patients that we tested for flu, not 20% of the total volume, but 20% of the patients we tested for flu were flu positive, to when the social distancing went into effect, we went to zero overnight. So that tells you how avoidable, I guess, the flu is. I think this social distancing will be a new wave for us. I think we are internally preparing in the fall to have another wave here until we know more. I think everybody is preparing for a surge until a vaccine is offered. And I'll tell you that from what we hear on the vaccine side, you're looking at anywhere from 12 to 18 months. They have to go through all the clinical trials and the approval, and they have to make sure that it's right. So I don't think that is a short-term solution. I think the social distancing will be a norm for us for a while. It's just to what degree and to what extent.
Mm-hmm. And for that vaccine, that 18 months, is that just for something to be approved, or is that something that's approved and available to everybody?
I think it's going to be, and this is my prediction, I think there's a lot of unknown about that, so don't take this as, what I say, but I think it's going to be similar to what you see in the toilet paper industry, similar to what you see in the lab supply industry, where I think it will be available. It's just in what quantity will be available. I think it'll have a stamp of approval, and then you're going to see all the vendors ramp up trying to offer the quantity to meet the demand. I think you'll see that will tell off as well, that there'll be another time period added to that.
Mm-hmm. What advice would you give to rural communities during this time? Do you see the virus reaching and heavily affecting those areas?
It definitely can. So I think one of the reasons why Tallahassee has been somewhat successful so far is that we started our social distancing stuff early. We started our testing early before we even had positives. And so if you're in a rural community, are you susceptible? Yes, very much so. But if you follow the same guidelines, if you enact things early before it hits your area, then you set yourself up to be successful in, treating it and getting through the wave of it versus not doing anything, waiting, letting it hit, and then trying to react.
What I will stress is I think what we're seeing in the rural communities now is there's two things. One, there's a lot of parties in the rural communities, and there's a lot of large gatherings. And we have heard that, we have seen that, whether that's through at the boat ramps and people congregating, on the water. And I think you see some things that have been put in place in like the Carabel area to mitigate some of that. I think that is a risk. The other is, I see the comment, Lake Cowlitz boating is still going strong here. So yeah, that's true. I think the other risk is we cannot stress enough that, I think our biggest challenge is healthcare workers going into long-term settings in the rural communities, so Jefferson County, others, even in Tallahassee, that have to make a living. So they can't afford to take off, but they're symptomatic. And then when they're symptomatic, they're spreading this virus to very fragile patients. And that is our biggest concern. Our biggest concern is having an outbreak in a group setting or long-term care. And that could wipe out a population pretty quick. So I think that's the biggest challenge in the rural communities.
Sean Dolce asks, there's a lot of concern for people who don't have primary care physicians. How can we best help and inform them?
We have a transition center here at Tallahassee Memorial. The transition center will allow us to connect them into a primary care, and we can get that number out to you all. So if they don't have a primary care physician, the transition center will see them, they'll screen them, and they'll do all attempts to link them into a primary care physician. And we know that. We want our community to have a primary care source. So we offer that service here. And we don't advertise this, but the Northwood Center, we have our transition center there to screen patients that don't have a primary care source as well.
And I would say too, in terms of what we all can do to help in those situations is educate as much as possible. We all have the capability to talk to one another about social distancing. We can all educate each other, about hand hygiene or wearing masks in public. And so those kind of efforts are the responsibility of everyone in the community. And so we can all do that, whether that's through social media, through TV pushes, radio, other ways to reach people besides just their healthcare provider.
Yeah, I see masks going very chic on the fall fashion week towards the end of the year. So, does anybody else have any questions? Jamie?
Yeah. Hey, good morning. And thank you guys for what you're doing and also for your time. I know it's at a premium right now, so thanks for being here.
Sure.
Across the country, we've seen a pretty significant, I would say stark racial disparity when it comes to COVID-19. I know Leon County has been lucky enough to not have a ton of cases like, New York, Chicago, Milwaukee, stuff like that. But are we seeing that same sort of unfortunate disparity in our cases?
So to some extent, yes. And I would say that a lot of that disparity is in line with our healthcare disparities in general, right? So people who don't have primary care providers, people who don't have adequate access to healthcare, those are the people that are going to be most affected and then probably the least educated regarding healthcare, information in general. And so those disparities kind of go hand in hand. But yes, I would say we're seeing that to some extent.
But it's very odd. Karen and I were talking about this yesterday. It's, one thing that we can't put a pulse on is you have fragile populations that have been impacted and compromised, but then you have that same population group that does well, that they have high risk, multiple comorbidities, and they are able to tolerate this virus with little to no symptoms. And then on the other hand, you have young individuals that are relatively healthy that are taking, that they're being severely impacted by it. There is something that we just, from my view, my vantage point solely, can't figure out in this virus that, there's two ends of the extremes. I think your high risk, multiple comorbidity patients, of course, they're going to be more vulnerable in this, but there's also the other extreme where you have completely healthy individuals that are young that are being impacted as well. And, we're seeing that through the healthcare workers. I mean, I think, one thing that's scary for us and what we have seen and our staff has seen, multiple healthcare clinicians have died from this virus, and they've been relatively young, 30s, no comorbidities, healthy, and we can't figure it out. And I'll tell you, most people that we see, you can't even tell they have the virus. And then there's others that, they're on the other side of the extreme, and it is very bizarre and very scary.
Do you think that this is going to change the healthcare conversation for us as a society now, as we see sort of to the point